of Health Sciences. So today, I want you guys to learn something new from me because I will be doing a return demonstration about the proper procedure of a complete physical examination. But first, let us talk about what is complete physical examination. A complete physical examination is a general examination of the body. The examination will cover most of the basic systems of the body, including the heart system, the lung system, the gut system, and the nerve system examination. Additional examination can be added depending on the clinical scenarios. And now, let us talk about the purpose of complete physical examination. The purposes of a complete physical examination are to confirm any present issues after the clinical history and to find possible pathologies that are present but yet to be known about. Good day, sir. This is Aliyah and I am your nurse for today. And I am here to perform an assessment. But first, is this patient Joshua?
Yes.
Which I will be going to perform a complete physical examination. So, this test is very important or very necessary for me to check your overall health and for me to check how well are you. Do you have any questions?
None so far.
Okay, and then if you have, please don't hesitate to ask me. And just sit, relax and bear with me. At first, you must perform a hand hygiene. And yes, don't forget to close the door as well as the curtain for patient's privacy. So in here, I will be going to ask my patient some question for his history background. Okay, so let's start first to the biographical data. Sir, can you please state your name?
Joshua Omar.
Okay, your address?
Block 51, Lot 21, Palau.
Okay, how about the date of birth?
April 11, 1999.
Okay, the place of birth?
Canlubang.
Okay, next is reason for seeking healthcare. Sir, what is your major health concern?
Asthma.
Okay, are you feeling comfortable seeking care with us?
Yes.
Let us now go to the history of present health illness. Sir, can you describe the character of the symptoms you are feeling right now?
I still having shortness of breath.
Okay, where does it begin?
When I was struggling up to right now.
Okay. Sir, can you locate and where does the pain originate?
Here in the chest.
Okay. Okay, next is the past health history. Do you have childhood illnesses? Okay. How about vaccines that you received?
I have complete vaccine.
Okay. Have you undergone surgeries? Do you have allergies?
Seafoods.
Okay, let us now proceed to the family health history. Sir, did some members of your family or maybe some of your relatives have experienced heart disease? How about diabetes?
No.
Okay, stroke. Cancer. Okay, let us now proceed to the environmental history. Sir, what risk are you aware in your environment or in your home, neighborhood, neighborhood, or in any other activities that you participate in?
I think there's someone who does not follow health protocols.
Okay. And what type of precautions do you take?
I always wear a face mask, face shield, and I always cut an alcohol.
Okay. Okay, we are now down to our last question, which is the personal and social history. Sir, allow me to ask these questions. How do you feel about yourself, about your appearance?
For me, I'm happy and confident about myself.
Okay, that's good, sir. And then, what do you do for fun and relaxation?
I always play and watch movie.
Okay, that's great. Thank you, sir. So, sir, for now, please allow me to ask few questions for me to assess your cognitive abilities. First is the orientation to person, time, and place. Sir, can you tell me where are we right now?
We're at the hospital.
Okay, sir. I am your nurse and you are my patient, and the time is 2:20 p.m. in the afternoon. Okay, sir. Next, I will be saying some words, and please do repeat after me to assess if you are able to focus and follow directions. Lovely,
Lovely,
adorable,
adorable,
handsome.
handsome.
Okay, sir. Can you raise your right hand? How about your left hand? Okay, sir. Okay, for the recent memory of happenings today, sir, can you tell me what is the first thing I did earlier before doing the procedure?
Introducing yourself.
Okay. Next, for the remote memory of the past, sir, what do you had for your breakfast?
Long silog.
Okay, how about for dinner the previous evening?
White rice and fish fillet.
And sir, next, I have here a paper with some shapes printed in it for me to test your abstract reasoning. Sir? Okay, sir. And then for judgment, what would you do if you found a stamped envelope on the sidewalk?
First, I will try to look for the owner.
Okay, that's good. Sir, for the arithmetic, can you please add this one? 1 plus 200.
201,
Oh, that's great, sir. Minus 90.
111,
Okay. How about 26?
666.
Okay, sir. And then, sir, for visual perceptual and constructional ability, I have different pictures here, and I will ask you some questions. Okay, are you ready, sir?
Okay.
Sir, can you tell me what color is this?
Peach,
Okay, how about this color?
dark blue.
Okay, how about the shape of this one?
Blue.
Okay, sir. What color is this?
Orange.
Okay. How about this one?
Black.
Okay, sir. How about the color, the shape of this one?
Irregular circle.
Okay, thank you, sir. Sir, on this part, can you please empty your bladder and take this specimen bottle? Thank you. So in here, I will be going to check my patient's vital signs. First is the temperature, and then the pulse rate, and then the respiration, followed by the blood pressure. For the general survey, first, I will be going to observe my patient's general state of health, height, build, and sexual development. Second, I will be going to obtain my patient's weight. Third, I will be going to note the posture, motor activity, dress, gait, grooming, personal hygiene, and any odors of the body and breath of my patient. Fourth, I will be going to watch my patient's facial expression, note the manner, affect, and relation to persons and things in that environment. Sir, can you clench your teeth for me? And then smile for me? Okay, sir. Fifth, I will be going to listen to my patient's manner of speaking and note the state of awareness and the level of consciousness. Sir, can you please repeat after me? Lovely.
Lovely.
Adorable.
Adorable.
Handsome.
Handsome.
Can you tell me what color I'm wearing?
Hungry.
How about this? What is this?
Wristwatch.
Okay, sir. Thank you. Next, I will be going to perform an assessment to my patient's skin, hair, and nails. First, I will be going to identify the characteristic of a normal mole of my patient. Second, I will be going to inspect my patient's hair for color, distribution, and quantity. Third, I will be going to measure the nail-based angle of my patient. Next, I will be going to perform an assessment to my patient's head and face. First, I will be going to palpate my patient's temporal arteries by noting the thickness, tenderness, and the hardness. Do you feel any pain, sir? Second, I will be going to auscultate my patient's temporal arteries. Third, I'll be going to check the function of CN7, which is my patient's facial expression. Fourth, I'll be going to evaluate the function of CN5, which is light touch and pain sensation on face, specifically on forehead, cheek, and chin. Do you feel any pain, sir? How about in here, sir? In here, sir? Fifth, I will be going to assess my patient's temporomandibular joint, and I will be going to test my patient's range of motion by asking him to close and open his mouth and then palpate for the joint space. Sir, can you please open your mouth? Open it widely, sir. And then close it, sir. Okay, sir, do you feel any pain? And then next, I will be going to perform an assessment to my patient's eyes. First, I will be going to measure my patient's visual acuity by assessing the distance vision, near vision, and the peripheral visual fields. Can you cover your left eye, please, using this small card? And then read left to right from top of the chart down to the smallest line of the letter that you can see.
E, F, P, P, O, Z, L, P, P, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, B, D, E, F, P, O, P, E, C, L, E, F, O, D, P, C, P, F, D, P, L, P, C, E, O.
Next, can you cover your right eye, please? Then read it again in the same manner.
E, F, P, P, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
This one, sir.
2,
This one, sir.
3,
This one, sir.
1,
Another. How many is this?
2,
This one, sir.
3.
Second, I'll be going to inspect the conjunctiva and sclera of my patient and note the color and discharge. Third, I'll be going to palpate the lacrimal gland puncta of my patient. Fourth, I'll be going to assess my patient's corneal sensitivity or CN5 using a sterile wisp of cotton. Fifth, I'll be going to evaluate the nasal balance and movements of my patient's eyes, and this test is an extraocular test to CN 3, 4, and 6. At first, I'll be going to use my pen light for performing the corneal light reflex. Second, I'll be going to perform the cover and cover test in the left eye and the right eye one at a time and observe the movement of my patient's eyes. Third, so in here, I'll be going to test my patient's eyes through the 6th cardinal field of gaze. Fourth, I'll be going to check the pupillary light reflex of my patient by darkening the room and by using my pen light to light on each pupil. Last, I'll be going to check my patient's pupil reaction to accommodation by asking my patient to focus on my pen light on a distant view and as I bring it closer to his nose. Now, let's go on to the skin, hair, and nail assessment. First, I will inspect and palpate my patient for color, uniformity of skin color, temperature, texture, turgor, moisture. Now, let's go to the ear assessment. First, I'll be going to inspect and palpate the external ear and mastoid process of my patient for size, shape, skin condition, and tenderness. Sir, allow me to assess your ear. Another one, sir. Next, I'll be going to test my patient's hearing through gross hearing acuity test. I will start with the patient's response to normal voice tone. Sir, allow me to assess your hearing acuity. And now, I will be going to use whisper voice to test my patient's hearing. And I will stand for about 1 foot away from you and out of your line of vision. And sir, I will first test your right ear. Can you please cover your left ear using your index finger? And then, when I whisper something, sir, repeat after me.
I am handsome.
Next, sir, I will be going to test your left ear. And sir, can you please cover your right ear using your index finger? And when I whisper something, repeat after me.
Just kidding.
And next, I will be going to use a tuning fork to perform Weber's test. So in here, I will going to strike the tuning fork lightly on my hand and then place it on the top of my patient's head. Sir, can you please tell me where can you hear the sound?
Equally in my both ears.
Okay, sir, that would be great. Next, I will be going to perform a Rinne test or ring test. So in here, after striking the tuning fork, I will be going to place the tuning fork or the vibrating tuning fork on my patient's mastoid bone. And when my patient said that the tone stops, I will move the still vibrating tuning fork to the ears opening without touching my patient's ears and ask him when the tone stops.
The tone stops. The tone stops.
Next, I will assess the inner ear structure of my patient. Allow me to assess your ear, sir. Now, let's go on to the nose and sinuses assessment. First, I'll be going to inspect my patient's external nose, deviation in shape, size, color, flaring, or discharge. Next, I'll be going to palpate the external nose of my patient for me to determine the masses, tenderness, and displacement of his bone and cartilage. Next, I'll be going to evaluate the patency of my patient nares. Next, I'll be going to test my patient's cranial nerve 1 or his smell by occluding one nostril at a time. Sir, please occlude one of your nostril and breathe normally. The other one, sir. Next, I'll be going to inspect, palpate, percuss the frontal and maxillary sinuses of my patient for tenderness or pain and swelling. Do you feel any pain, sir?
None.
Do you feel any pain, sir?
None.
Next, I'll be going to inspect the lips, teeth, hard and soft palate of my patient for symmetry, color, edema, surface, or in any abnormalities. Next, I'll be going to palpate the temporal, masseter muscle or the cranial nerve 5 of my patient. Sir, allow me to assess your side profile. Do you feel any pain, sir? Do you feel any pain? Next, I'll be going to inspect the cranial nerve 7 or the tongue of my patient or the hypoglossal nerve of my patient. Sir, please allow me to assess your tongue. Open your mouth and say ah. Ah. Okay, sir. Next, I'll be going to palpate the uvula and elicit the gog reflex of my patient or the cranial nerve 9 and 10 of my patient. Sir, allow me to assess your mouth and then please open your mouth wide. Sir? Next, I'll be going to assess the sense of taste or the cranial nerve 7 or 9 of my patient. Sir, allow me to assess your sense of taste. And please identify what flavor I will be giving to you.
Sweet. Salty.
Now, let's go on to the neck assessment. First, I'll be going to test the range of motion of the cervical spine of my patient. Sir, allow me to assess your cervical spine. So along with your head, please look down. And then look up, sir. And then to your right, sir. And then to your left. Okay. Next, I'll be going to test the strength of the sternocleidomastoid and the trapezius muscle of my patient, or the cranial nerve 11, or the spinal accessory of my patient. Next, I'll be going to palpate the trachea of my patient. Next, I'll be going to palpate the thyroid gland of my patient and in any irregularities. Next, I'll be going to palpate the carotid arteries of my patient one at a time. Next, I will be going to palpate the lymph nodes of my patient in this sequence: preauricular, posterior auricular, occipital, submental, transmandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Now, let's go on to the hands, arms, and fingers assessment. First, I'll be going to palpate the epitrochlear lymph nodes of my patient. Next, I'll be going to test the range of motion of my patient's elbows, flexion, extension, supination, and pronation. Next, I will be going to palpate the brachial, ulnar, and radial pulses of my patient and compare their characteristics bilaterally. Next, I will be going to test the deep tendon reflexes of my patient's biceps, triceps, and brachioradials. Next, I will be going to assess the neurologic function of my patient through light touch, pain sensation such as extension, proprioception, stereognosis, graphesthesia, two-point discrimination, rapid alternating movements of hands and fingers, and finger-to-finger and finger-to-nose test.
Forehead, nose, cheeks, ears, throat, neck,
Next, I will be going to inspect the chest, front and back, noting the thoracic landmarks, size, shape, and specifically the anterior diameter compared with transverse diameter and symmetry. Next, I will be going to palpate the chest symmetry, pulsation, sensation of my patient such as crepitus, grating, or vibration of the thoracic expansion and tactile fremitus of my patient. Take a deep breath, sir. Can you please take a deep breath, sir? Take a deep breath. Again, sir. Again, sir. Again, sir. Again. 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 Again, sir. Next, I will be going to percuss for tone at posterior intercostal spaces of my patient and then compare them bilaterally. Next, I will be going to percuss the left and right costal vertebral angles of my patient's kidney tenderness. Next, I will be going to determine the diaphragmatic excursion of my patient. Next, I will be going to auscultate for the breath sound and adventitious sound of my patient. Now, let's go on to the heart assessment. Next, I will be going to auscultate the heart of my patient for rate, rhythm, sound, murmurs following the sequence, aortic area, pulmonic area, tricuspid area, and the mitral or apex area. Now, let's go on to the abdomen assessment. Next, I will be going to inspect the skin contour symmetry of my patient's abdomen, starting by inspecting the umbilicus for location and color, and then auscultating for vowel sounds and percussing for tone, liver span. Next, I will be going to lightly palpate all quadrants of the abdomen of my patient while assessing its muscular resistance, tenderness, and masses. Next, I will be going to deeply palpate all the quadrants of the abdomen of my patient while assessing the bulges, masses around the umbilicus and umbilical ring. Now, let's go on to the legs, feet, and toes assessment. First, I will be going to palpate the popliteal, dorsalis pedis, and the posterior tibial pulses of my patient. Next, I will be going to perform a Hill-to-Sheen test while securing my patient and assisting him in standing position. Next, I will be going to test for the dip tendon reflexes, specifically the patellar and Achilles area of my patient. Next, I will be going to test the range of motion of my patient's knees and feet. Now, let's go on to the musculoskeletal and neurologic assessment. First, I will be going to assess for the spinal curvatures of my patient. Next, I will be going to observe the gait and balance of my patient and asking him to walk normally, tandem walk, tandem balance, and through a Romberg's test. And that ends my written demonstration about the proper procedure of a complete physical examination. I hope you learned something new from me today. I hope to see you next time in my another written demonstration. Once again, this is Aliyah Piayeras, a nursing student from LPU St. Cabrini School of Health Sciences. Thank you for watching. Bye!